Good evening and welcome to Washington. I'm John Roberts, in for Brett Baer tonight. We are getting our first look this evening at the long-awaited health care reform plan from Senate Republicans. And according to many on both sides of the aisle, the prognosis is not good. That Democrats are against the bill is a given, but Republicans have a razor-thin margin of error, and there are already indications of enough defections to scuttle the measure. Our chief congressional correspondent Mike Emanuel starts us off tonight from Capitol Hill. Good evening, Mike.
John, good evening. Republican leadership expected opposition from Democrats, but are now facing it from 4 of their own. President Trump sounds ready to deal.
Obamacare is a disaster. It's dead. Totally dead, and we're putting in a plan today that's going to be negotiated. We'd love to have some Democrat support, but they're obstructionists. They'll never support. We won't get one, no matter how good it is, but we will hopefully get something done, and it'll be something with heart.
The 142-page Senate Republican plan to scrap Obamacare and replace it with what GOP leaders say is a better system was released today. Some key differences with the House Republican bill are on tax credits to help people buy coverage. In the House, they're based on age. In the Senate, tax credits are based on age and income. Pre-existing conditions. In the House, insurers in waiver states can increase premiums based on pre-existing conditions. The Senate prohibits insurers from increasing premiums based on pre-existing conditions. Expansion of Medicaid. The House cuts funds for new beneficiaries in 2020. The Senate funding will phase out from 2020 to 2024. Medicaid cuts. The House, states are given block grants based on current per capita spending. The Senate, block grants to states would grow more slowly after 2025. Senate Majority Leader Mitch McConnell made the Republicans' case.
Now, Democrats would tell us it'd be wrong for the Senate to actually address these problems in a serious way, while the law they've defended for 7 years teeters, literally teeters on the edge of total collapse.
However, 4 GOP senators, Ted Cruz, Ron Johnson, Mike Lee, and Rand Paul, came out against it in its current form, enough to kill the bill.
We're open to negotiation, but we want the bill to look more like a repeal. We're afraid that when we read the bill, that it actually looks like a reiteration or a keeping of Obamacare.
I want to get to yes, and the way to get to yes is fix the underlying problems, lower premiums, and I will happily be part of it.
No cuts to Medicaid! Save our liberty!
Disability rights protesters were on the Hill today to oppose reductions in the growth of Medicaid spending, saying it could mean life and death for the disabled. As expected, Democrats quickly attacked the package.
It's every bit as bad as the House bill. In some ways, it's even worse. The president said the Senate bill needed heart. The way this bill cuts health care is heartless.
The speech you just heard was about a bill that he hasn't seen.
142 pages thus far of the supposed bill have been printed online, and that's what I have used.
The tension on the Senate floor over health care didn't end there.
What is being talked about here is like having a hole in the roof of your house. Instead of patching it, they want to burn down the house. So what we are not willing to participate in is burning down the house.
I would suggest to the senator from Michigan that it is the Democrats under Obamacare who burned down the House, because the individual market for health care has been decimated.
The Congressional Budget Office says it should have an estimate of the price and impact of this bill by early next week. Senate GOP leadership has set a goal of a vote before the 4th of July holiday. They say there's ample time to read and discuss it. John?
Mike, I'm not sure if it's hotter outside or inside there tonight.
Lots of tension on both sides of the aisle and even within the Republican ranks, John.
All right. Thanks, Mike.